Good afternoon. My name is Amal Nirgodkar. I'm the CEO of Patient Prism, and I'm here in my makeshift home studios. I'm talking to industry leaders and thought leaders in dentistry, and who are helping us, who have come out of their homes to really help us produce really good content that will help our industry during these tough times. And we are in a tough period. There's no argument about that. Every single American today is facing this crisis, um, psychologically, emotionally, physically, sometimes financially. All of us are facing a tremendous amount of anxiety and stress that is resulting from all the things that have come about as a result of this COVID-19 epidemic. And so we wanted to bring an expert in stress management on this program, because we feel that it's our number one issue is dealing with stress. I wake up every morning thinking about this. I look at my world meter and seeing how many cases yesterday or today, and it's kind of it doesn't escape your mind. So Jen Butler is an incredible consultant to dental practices. Over the last 25 years, she has helped organizations cope with stress, teams cope with stress. She's worked exclusively in dental for the last 10 years, and really now focuses her efforts on coaching dentists and team members on managing stress better, even during non-crisis times. So now having you today is I feel so good, because I think I'm going to feel better after this talk. But really, welcome, Jen. Thank you for making time today.
Thank you. It's my pleasure. It really is. Thanks.
Jen's recently written a book for us, ebook called "Coping with Unthinkable Stress." We're going to make that link available at the end of this webinar as well. But I really want to start out right away asking you, how do you really define stress?
That's a really great question. There is no universal definition of stress. You would think, with it being before our COVID-19 crisis, the World Health Organization actually has said for the last almost 10 years, stress is a pandemic. So you would think there would be a universal definition. There's not. There's two common accepted schools of thought, and I lean towards the definition that goes like this: that stress is the way we perceive the world and our ability to tap into coping methods and resources to navigate what we see. Okay, so I'll repeat that one more time, because it can be a little wordy, but so stress is the way we perceive the world and our ability to tap into coping methods and resources to navigate the world we see. And that definition is really powerful, because we have the choice, we have control, we have influence on how we perceive the world. So stress is, in dentistry, is not innately stressful. It's how we see dentistry, right? If we see dentistry as stressful and we don't have a lot of coping methods, right? We don't have a lot of resources or tools to use to reduce that stress, that's when the stress goes up. Now, who the hell was prepared for a COVID-19 pandemic crisis, right? Right. There's no, I mean, I'm creating coping methods in the moment and sending people like this ebook, you know, on how to manage this kind of thing. Right. So right now, as you were saying, people are waking up. There's not a lot of tools out there specifically for this, but there are, and I hope to get to that, there are coping methods, tools, and resources that are general enough that everyone can use to reduce their stress.
So since we are in dentistry, obviously all of us need this help, right? You talk about coping mechanism. What specific you think coping mechanisms can dentists and team members and all of us use to reduce their business stress currently? I mean, there's a whole lot of stress around business.
Absolutely. So there are 6 steps that I have been trying to really get out there. This is in addition to the ones that I provided in the ebook. So get the ebook, because these are not included in the ebook. So when we feel we are in crisis, another way of saying crisis is panicked, afraid, fearful. We can get a thesaurus out and change that word up, because some people don't see this as a crisis. Some people are still in the camp that, oh, it's fine, it's okay. They're still not social distancing. They're still, so I want people to realize that that I'm coming from that physical, biological perspective of our stress levels, okay? Not necessarily how we just generally feel about it. And so if you're feeling a crisis, if you're feeling panicked, if you're feeling fearful, worried, concerned, these are other words. The first thing to do, especially in business, especially, it's so important, is to stop. Number one, stop what you're doing, stop what you're thinking, stop what you're feeling, stop. And I'm not saying stop permanently, I'm just saying stop for the moment.
Sure. Because
when we're panicked, right, our critical thinking, our concentration, our focus, it goes down. And we can get into the science of it and why of it, but that's a longer conversation. You just have to trust me right now. Sure. That with the cortisol and everything else, it's called foggy brain. And everyone goes through it when we're under stress. So when we're business people and we need to make critical decisions like closing your doors, laying off your staff, collecting unemployment yourself, what bills you're going to pay, talking to your landlord, these disaster loans. I mean, everything is coming at us. Like right? Just stop for a minute. Stop. And then you got to breathe. When our stress response is triggered, and please, I can talk about this without taking a breath for hours on end. So if you've got a question, sure, just interrupt me. I'm not offended, right? But when our stress response is triggered, and I'm talking the internal biological stress response, it causes our heart to beat faster, which causes us to shallow breathe. So when that stress response is triggered, we are not getting the oxygen to our brain, because that's not what the stress response is trying to do, right? Right. So we need to interrupt that process. So when we stop, we need to diaphragmatically breathe. So let your gut hang out, seriously, like let it hang out and breathe with your belly rising. We do this when we're sleeping. We do this naturally as we're babies, right? But you did this, you still went, right? I really mean your shoulder, like seriously, in and out. Like my shoulders won't move if you are breathing in and out, because we are reducing our oxygen intake, not because of our inhale, but because of our exhale. So we call it the 5-10-10 rule at JB Partners. In for a count of 5 and out for a count of 10, where you really have to at the end be really pushing it out to get all that carbon dioxide out, okay? Once we get that out, then we take really good inhalations. It slows the pulse, reduces or lowers the blood pressure, slows the heartbeat, increases the oxygen to the brain, and then it clears up that foggy brain for us so that we can make critical decisions. Because as a business owner, decision making right now is I think what I'm hearing, and I think you and I were talking before, is that it's all the decisions needing to be made that are impacting our staff, impacting our families, impacting our finances. So we have to do everything we can to keep our brain alert, sure, and healthy to make healthy decisions.
So to stop you there right now. So the first thing is you stop and you breathe and do the diaphragmatic breathing.
Yes.
That's step number 1.
That's 1 and 2. Stop, then breathe. Step number 3.
Okay.
Stop and breathe, and that's do an affirmation. So not only do we need to pause or interrupt our stress response, yeah, our goal is to trigger what's called our relaxation response. And this is another internal process that we have that slows the cortisol and the 120 stress hormones that flow through our blood our bloodstream while we are under stress. So it's important then to also interrupt our thought pattern. So say a positive affirmation, pray, say proverb, say om, I have people that just talk out loud and say, stop, 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 stop. I sing the ABCs. I say a mantra. I say, this is but a moment and this too shall pass.
Right.
Right? Just say something to interrupt your thought patterns. And then that's step 3. Step 4 is to ask. And it's vital. The first question you want to ask as a business owner while in crisis or under stress,
Right.
that is, what do I need right now in this moment that will make the biggest impact to get me to the next moment? Because that's all crisis is. That's all panic is
Right.
one moment at a time.
I see.
Okay. So sometimes what we need is to talk to somebody, to shut down for a minute, to go take a walk, to have some water, rehydrate, hug your puppy, hug your kids, watch a funny video, just whatever it is for that moment. Step 5 is to narrow your worldview. Because remember, our definition is how we perceive the world. Well, the world is freaking scary right now. Okay. Or if we don't see it scary, there is scarcity. Okay, so even though mindfully we might not think it's scary, like I don't think the world is scary right now,
Sure.
but my body, my stress response is looking at the world going, there's no toilet paper, there's no eggs, there's scarcity in the world.
Right.
And so that triggers my stress response without me even realizing it. So narrow your worldview, which means narrow your decisions. Make them small. If laying off your entire staff is too much, lay off one.
Right.
Just take things, and then the last step is to take things in bite-sized pieces. So that is the 6 steps to crisis coping. And it can take 60 seconds. It sounds a lot longer than it is, but really it's just 60 seconds that will help you as a business owner make what I call decisive decision making. And right now with owners, if they can make decisive decision making instead of being in limbo, instead of going, well, I don't know, right. That will reduce their stress. But some of them can't get to decisive decision making because of all the other.
They're paralyzed, right?
Exactly.
A lot of people feel very paralyzed during this time, and they kind of get themselves into this little place where they're not moving, they're not doing any of the stuff that you talked about, and it leads to paralysis completely, and it makes the situation much worse.
So for that, the reason that people are paralyzed is because most people know about the fight or flight response. Right. Well, it really is the fight, flight, or freeze. There are 3 ways that we respond to stress. So if your listeners, if people are out there and they're paralyzed, right. That is their stress. That is their body telling them, I'm under so much stress. I am so afraid. I view the world as threatening, so I'm not going to do anything. And as business owners, we do not have the privilege of being frozen. So that's why then you go back to our 6 steps of crisis coping, right?
So now most of us, at least in most states, are home. Mm-hmm. And that comes with a new level of stress as well. I mean, we have stress in business, the teams and all that stuff, but we're home, we're with our family, which is great. But it does create a new level of stress because all of a sudden you feel almost isolated. You're always out meeting patients and team members, and the interactions that you've had with other people have stopped. And to a large extent, for most extroverts, all right, it's difficult to survive at home when you have nobody to talk to. Yes, you have your family, but you're not used to talking to them 24/7. Right?
Right.
You're used to talking to them, every once in a while.
Yeah.
Some people like it that way, right?
Yeah. It creates healthy relationships that way.
Absolutely. But what do you do, right? While you're home, you have kids doing homework and all this stuff. How do you cope up with stress at home?
So that is a great question. And the answer is probably not what you imagine. So first of all, one of the things to recognize that it's not just you, the dentist, that is home. It's everybody's home. So And every single person has a stress response. It's not just the dentist.
Right.
Every single one of us is born with a stress response. So even the kids. So we actually on our website have resources for like how to know if your kids are stressed, and go to jenbutlerpartners.com. You can download all that stuff for free. But one of the things is for sure to keep with the routine and structure. Beth and I were talking about this is the first time we put on makeup in days, right? If that is part of your normal routine, continue to, as a woman, continue to put on the makeup. Continue to get dressed. Make your kids get dressed. No, don't stay in your jammies Monday through Friday. It's tempting. Although this is not a vacation. Stay in your jammies on Saturdays and Sundays. So really stick to a schedule. Now, I'm not saying you have to stick to the schedule you had when you were working or the kids were in school.
Correct.
You know, maybe instead of starting at 6 in the morning, you're starting at 8. But structure is key because it's predictable and repeatable. When things are predictable and repeatable, and again, it goes all to the brain, right? It's all about biology. Our brain trusts the environment. It feels safe, so it doesn't trigger our stress response. This vacuum cleaner is going to come in my office. I just know it.
Well, I'm with a company right now, and remember robots. The Roomba is going to be some stress management.
That is right, because I don't have. It is. It's coming right in my office. Hold on. Edit that out, but that's hysterical. It made it has the whole house.
Well, it interrupted your pattern of thinking. See, it interrupted it, and maybe it's this is how technology helps with stress management.
Absolutely.
It comes and gives you company, and it's great. I mean, it's about interrupting your thought pattern, right? And it did.
Yes, it did.
But this is good. This is good. I think it's a great example of how you could, a small thing like a vacuum cleaner coming in could interrupt the way what you're thinking, because it takes your mind off of that.
Well, and the other thing is it keeps my house a little bit cleaner than me having to, vacuum. Another so structure is really important. Anything that's predictable and repeatable. Like I know every day that vacuum cleaner is going to start at 10 a.m. and I should have prepared a little bit more and paused it for this recording. But it's fine. So predictable or repeatable. So another thing is to give everyone space. What I am suggesting is that if you're working from home and multiple family members are working from home, get out the blue duct tape and and say, okay, this is the school zone right here. When you're in school, this is where you are. Because then what happens is school becomes all over the house.
Right.
Right. And then no one has defined spaces.
Correct.
And then again, our worldview is this house is crazy. There's schoolwork everywhere. Narrow your worldview. So get out the blue duct tape and say this area, this is where all the schoolwork goes. Right. This area, this is daddy's work, right? This is where daddy works. This is mommy's work. And create defined spaces. Again, it's predictable and it's repeatable. Then always throw in fun. Laughter is one of the top 10 ways to reduce stress because it releases oxytocin, which oxytocin eats up the cortisol in our blood, right? And in our brain. So I tell everybody, watch at least one funny video, like a TikTok or something like cat videos every hour. That needs to be part of people's work schedules and kids' school schedules, is just to watch something super funny. Laugh, tell a joke, to get that oxytocin going.
Interesting. So have a schedule. I agree with that, because I'm wearing my usual office shirt.
Yeah.
I gelled my hair. I even today, for the first time in my house, usually I'll have some sort of a cologne that I'm wearing, and I wore it today because I feel like I'm in an office environment and I'm working, and it's helped me because it helps me my focus. I don't feel like all the house stuff is around me, and so having that routine is great. But I love the idea of spaces around children, because you want them to have some sort of a structure, at least during school times. Then after that, they can do whatever they want.
That's right.
and interrupting every hour with some sort of a fun video or laughter sounds like great tools to help us at home. But we still do feel panic, right? We especially one of the things I don't do today or last week, I stopped turning the TV on all day because the thing with TV is that they keep repeating all the negative stuff because that's what sells as news. So there is moments if we keep ourselves latched to our devices or TVs, or sometimes it happens automatically. We're panicked, right? And in moments of panic, we don't feel that. How many times can we complain to the family members? Oh my God, this is crazy. What can we do? Like you talked about freezing earlier. Um, what do we do when we're panicked? Besides the stuff that you already talked about, breathe, diaphragmatic breathing, interrupt the pattern, all that stuff. Is there anything that we can do to immediately get ourselves better? You have 6 things you talked about earlier.
Right.
But is there a way to avoid panic? Maybe that's the question.
Well, and that's actually one of the things that is in the content of the ebook. They're called the 4 A's of stress management.
Okay.
So, and we go into more into detail, but one of the A's of stress management is avoidance, is to truly avoid that stress trigger. And I agree 100% with you that people forget we have a conscious mind and an unconscious mind, that our brain in our unconscious mind is taking in cues and is constantly listening to the world around us, which then triggers our stress response. So if you've got the TV on going all day long, even though you think you're not actively listening to it, your unconscious mind is. So turn off that doggone TV.
Right.
Turn it off. I allow myself 20 minutes in the morning from 7 to 7:20 to watch the top of the news hour, and then 30 minutes at night. That's it. That's all I watch of the news. There's nothing that can happen.
Right.
In between that 12 hours, that's going to impact my life that much, right? It's just not. So avoid the stress trigger. Figure out what is causing that panic. Is it the news? Is it hearing all the bad news? Is it social media? Is it your kids that they're fighting a lot? Oh, let them fight. You, instead of sending them to the rooms, you go to your oasis. Here's another thing setting up your environment at home to have one space for yourself that you get to claim as yours. Nobody else can go there. Now for me, it's my side of the bed, right? That's my place. I have roses that I keep. I've got rose bushes that are blooming right now. I keep roses on my side of the bed. I have my journal. I've got a candle on my side of the bed. I've got all these senses, things that will spark my senses, so that if I need to go avoid something, I'm like, okay, I'm going to my space and I'm going to light the candles and I'm going to journal a little bit. I'm going to sit there. I'm going to put on some classical music, even if it's for 5 minutes. So making sure everyone has that safe place at home that is theirs, that no one else can bother or move or touch, and then use the senses more to avoid that stress trigger, to calm your nerves, to calm that panic.
So you talk about 4 A's of stress management, especially when we're in trouble. Adapting. You talk about adapting, avoiding. You talked about adapting is, I guess you just adapt to whatever is happening. Is that what adapting means?
Well, adapting can mean that you adapt, right? That you need to adapt some way. So let's say you got a nagging mother-in-law, right? Or let's say you don't get along with your in-laws. That's actually a common stress trigger for people, family members that irritate them. So you either can adapt the way that you perceive them, the way that you interact with them, how you interact with them, when you interact with them. Do you interact with them one-on-one, in a group, blah, 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 only through Zoom? So you can adapt, or if it's a stress trigger that you can change how that stress trigger is. For example, the structure of your team. So there are the top 5 dental stressors are time pressures, uncooperative patients, demanding patients, team issues, and then financial issues and feelings of isolation and loneliness. So team issues, though, are 100% in control of the business owner.
Right.
But when I work with teams, when I work with doctors and teams that they're so stressed out, they're like, oh, well, they're not doing anything about their team, right? Either changing it. So if your team stresses you out, change your team. Now, I'm not saying fire or lay people off, but give them training. Do something with the stress trigger. Just don't tolerate.
And then you talk about altering and accepting. What does alter mean? Is it alter the way you behave, alter the way you perceive, or is it just what do you mean altering?
So yes to all those things that you just said. So again, where adapt is that you don't remove the stress trigger from the situation. You adapt to how it is. Altering, again, is where you might totally change the stress trigger. So you might lay off or fire people. You might decide, these family members are so toxic in my life, I'm going to remove them, or I'm just only going to communicate via letters or something. So you really alter the situation completely. And then accepting, that was the other one we didn't talk about, right?
Accepting, yeah, accepting, yeah.
Yeah, accepting. So Beth asked me a great question a week or so ago. About, is accepting the same as resigning to something? And I'm like, no, resigning is like giving up. It's like, okay, well, crap, this is the way things are. I just have to suffer with it. That's called victim energy, right? Where we feel stuck, we don't do anything. And I tell people, whatever you tolerate, you give permission to. That's just a basic truth, right? Whatever you tolerate, you give permission to. So by resigning to something, that's like saying, okay, beat me up, that's fine, whatever. And it's a passive I give up. Accepting is an active role. It's an active participation in whatever is happening. Okay, so we all can accept what's going on with this COVID-19, and we don't have to. We don't have to stress about this. I'm not stressed about it. I'm not a fairy tale, rose-colored glasses, la la land.
Right.
But there is a way to simply accept what's going on and be an active participant as well.
Sorry, go ahead.
I was going to say, like, get the loans, reach out to your team, find a way to look at this as a learning opportunity, to appreciate your teachers more, your kids' teachers more. Yeah. Finding out a way of, what are my kids learning? I mean, this is really a gift and a blessing that for parents, for business owners, like the clients that I'm working with right now with business consulting, we've laid off all the staff, and they are learning every single thing about their business, from their automation process to their P&L, to having meetings with their CPAs, there's no better business school than right now, if you look at it that way.
Yeah, I think accepting that what's in our control today is what we can do with our time and ourselves, and why not make it better. I read yesterday on a Facebook, sometimes they have these amazing, and I'm going to read it to you. It said, it was not a meme, but it says, if you don't come out of this quarantine with a new skill, a side hustle, or more knowledge, you never lack time. You lack discipline and motivation.
Absolutely.
And it really pumped me up. I'm like, what is the new skill that I can learn during this time? And that again shifts our perspective and perception from what's affecting us to something brand new. Mm-hmm. We could be looking on LinkedIn, trying to connect with new people. Mm-hmm. We've lost a job, we need a new job. Let's connect with people that we normally don't have the time to connect with because we're so busy. And I think these are, extremely good points. I recommend everybody download the ebook, and if you need more help, obviously contact Jen. But the last question I have really for you is a difficult one. We've been in dentistry for a long time. I have some of my closest friends are dentists and hygienists, and team members and office managers. And one of the we know dentists have level of stress. Depression is pretty high. We know the statistics that it's the highest amount of suicide rates among all professions is in dentistry. So what worries me during this crisis is that we don't want our doctors to go into a dark place today. They may be somewhat in a dark place. We don't know that, but now we don't want this to be the catalyst for something super bad, because obviously we know this is going to pass. We're going to all come back. Patients are going to all need dentistry, and it's temporary, right? This too shall pass, is what you say. And so what are some tips about, if you are depressed, or if you are getting depressed, and to not go over that, fall off the ledge, for lack of a better word. What's your advice about that?
I'm so glad you brought this up, because there are already reports of suicides in dentistry. I know of two personally. I didn't know them personally, but I know people who knew them. And there's something called our stress threshold. And when we surpass that stress threshold, that's where we get to the dark places. We all have this stress threshold. And for those docs, I agree with you. For those docs that were already so stressed out, or this is the straw, right? They're just like, I can't come back from this. They were already too deep of a hole where they couldn't see the light anyway. Right. So there's a couple things. One, first and foremost, pick up the phone and call your medical doctor. Suicide is or thoughts of suicide. Every single person in this world has moments of, I just want things to be over. We all have those moments. But if you are really thinking that, and that's natural, that's normal. But if you're thinking that I want things to be over, and I don't want to be here around for it, it is imperative that you call your medical doctor immediately, because it is a condition. It is a biochemical condition. It is a biochemical condition that turns into a mental health condition. I cannot stress that enough, right? There are pills for this. People are looking for pills for periodontal disease. How many times we have patients say, well, can't I just take a pill for my infection? Can't you just write a prescription? There is literal pills for those deep, dark thoughts. Right. So many people in dentistry, and I can start quoting some numbers, and we can go into the research. Again, that might take too long. But there are studies that are done in the dental field here in the US that dentists would rather close their doors than to get mental health. Wow. They would rather do nothing than to seek support, or to call their doctor, or for anybody to tell anybody that they're sad. So I plead and beg, please call your medical doctor. That's one. Two, when people are depressed, true depression, they don't think rationally. And picking up the phone and calling their medical doctor might be too heavy of a burden. Sure. And I share publicly, I've had two in my life. One of the reasons why I'm a stress management person is I have had 2 suicide attempts. I understand depression. And both times in my life, my family members needed to make the call. I couldn't pick up the phone. And I'm highly educated. I'm extremely smart. I'm loving. I'm a good person. but I could not pick up the phone in that moment. So if you know someone who you think is suffering, please pick up the phone. Just call the medical doctor or call a suicide hotline. They're open 24 hours a day, 7 days a week. There's a national hotline, there's a state hotline, there's local hotlines. You can Google suicide hotlines and they will be there and talk you through it. And I just can't stress enough that this kind of thing is normal. So reach out to somebody. And if someone does reach out to you, don't be afraid to pick up the phone and call a mental health professional.
Sure.
Right?
And right now, that's one thing you can do remotely.
Absolutely.
Right? You don't have to go meet with them. You could get a Zoom consult with a psychologist, a mental health counselor. And it's okay to feel extreme sadness right now. I get it. And all of us feel it. The financial definitely adds on top of everything.
Absolutely.
Because you don't know if you can pay your bills, and you're doing everything that you don't like doing. Firing people. You don't like firing people, you have to fire people. Calling your landlords, calling your vendors, calling every single person. Every difficult thing that you've avoided in the past, now all of a sudden is hitting you with like a ton of bricks. And it could roll you over. But I think seeking help, or if you can't do it, hopefully a family member can do it for you. And those are really good tips. So tell me, Jen, we could talk about this all day. And you've done some great work at Patient Prism Academy and many, many things. And I want to welcome you again once this subsides to come and record with us. But if people want to contact you, we're going to leave the information up here. But just go ahead and tell us what's the best way to contact you, and we'll put that on information on the screen.
You can call our telephone number. The best thing to do, though, is go to our website, jenbutlerpartners.com. You can email directly from there. It comes to me. I don't have a virtual assistant. I don't have, and it's not because I choose to operate this way, because of the content that we work with, right? Everything comes directly to me, and then I delegate out. So I see everything first. And if you are stressed out, I don't charge for phone calls. I don't charge for emails. I don't charge for any of that. You have a resource now that you don't have to worry about the financials. Okay. The email is info@jenbutlerpartners.com, my website. You can follow me on social media. And one other thing I just want to squeeze in here real quick, because I've seen this a lot, and that is not only to watch the news, Amal, but it's important that everyone watch those dental threads that are out there on the message boards. Some of them are pretty negative, right? They're just all about bitching and venting, and that's fine. And there needs to be a thread for that, but don't live in that thread. Right? We want to be able to vent. Vent needs to release pressure. Once that pressure, we need to vent, but then we need to leave it and go to a positive thread. We need to go to a thread or talk to people that can help us see this situation in a different view, because living in those message boards that are nothing but negative constantly only validates your fear.
Jen, in addition to those negative threads, I've been part of a lot of positive threads as well, and they have really helped me, uplift myself in feeling better about how to deal with situations. And there's a lot of help out there on Facebook with our community members from dentistry that are wanting to help and sharing all the information. So it's been great for me.
Yeah, absolutely. And I encourage the groups that you're in, please invite me to those groups. I'd love to be able to provide resources and support, and help people meet them where they're at and move them forward. So thank you so much for having me today.
Jen, it's been my pleasure, and thank you for sharing your time. I know you're very busy. There's a lot of people reaching out to you, and I cannot wait to talk to you again. But thank you again for helping our audience with some very helpful tips in managing stress. So I really, really appreciate it. Thank you.
It's my pleasure. I look forward to talking to you.